In my PT 837 clinical, my CI definitely demonstrated excellence in just her day-to-day practice. She was very good about knowing her boundaries and not being afraid to admit if this was her first time doing something or if she had to go look up something. And she was very just transparent with the patients to make sure that they knew that she was capable of doing it, but wanted to make sure that she was doing it in the correct manner, so that they didn't have to do it multiple times, especially with vestibular patients, since she did a lot of that, making that sure that some of the less common treatments she would look up sometimes either before seeing the patient or would check to make sure before she did the treatment, because they are uncomfortable for some patients to have to go through. Also, she demonstrated excellence through just taking the time out of her lunch sometimes to see patients that weren't able to get an appointment, but still needed to be seen right then. She would take some time out of her lunch to see them, to make sure that they were getting the proper care they needed, especially with surgical patients, to make sure that they continued to make progress. It was really important, and she would take that time and see them. And then she was always taking and looking up information to further advance her knowledge and to keep giving the patients the care they needed. So just demonstrating all that, I feel like she was able to demonstrate the core value excellence.